So he's tweeted that it's on. Apparently, Matthew Holt is throwing down, launching a new conference, Policies, Techies, and VCs in September. He's taken me along with him. And you know what? I don't got his back if this is some sort of conference street fight. I might be scrappy, but I am not willing to throw myself into the fray. It's the June 4th episode of Held in 2 Points. Uh-oh. Who do you think you are? What are you?
It's on like Donkey Kong.
Why are you throwing down? Like, you know, I don't have your back at all, right? Like, there is like, you can tag team and there's no tag back. I'm like, you're on your own, dude.
You think in a street fight I need your help? You're just there. You're just there for the ride and to do the content and to do the actual interviewing and to do all the work and to do, and to make sweet with all the people upset.
Make sweet. I'm trying to get Glenn Tolman and Jonathan Bush into a cage match session. The best part about that is Faye Rotenberg, Jonathan's wife, is like, yes, cage match, totally. We're in. And Jonathan's like, what?
Yes, everyone wants that apart from those two. But we'll see.
Fight. That's the fight we're getting into. You need to stop throwing down. Let's just get those two into the ring.
All right. Well, if you hadn't heard, Policies, Techies, VCs, what's next in health tech? In healthcare is the new. I should get the name of the conference right. What's next in healthcare is the conference we're launching. It's going to be a virtual conference, September 7th through the 10th.
The website is what'snexthealthcare.com.
Very good.
Check that out.
So we're looking forward to that. You and I finally getting out of the 2-minute row.
Speakers, sponsors, random panel ideas.
We have some pretty damn good speakers already, though. We've got 20 of the best CEOs in health tech, and we're going to be adding a few policy people.
Leveraged every relationship we had to get that.
No, there's a few more. There's a few more to come. Right, it'll be fun. We'll talk more about that over the years. But right now, Jess, aren't we supposed to be doing?
Oh my God!
More money today, flying around the ecosystem.
I can't even explain what happened today.
Well, the good news is you don't have.
We've had some crazy days here in health tech funding. But this day is...
You don't have to explain because you've got me to do it for you.
Yeah, your time credit at 200 something episodes, still a struggle. And here we go. 30 Madison gets $140 million. They are now a unicorn, billion-dollar valuation. Matthew Holt, why? Oh God, why?
So this is, a competitor to Roe and Hims, which have also got billion-dollar valuation plus, and they give a different brand to every different pill they sell. So there's one for allergies now. There's one called Keeps, which is to keep your hair, which is like Rogaine. There's one for allergies, which is called Picnic, because I guess you got cyber picnic and allergies. There's one, there's like 5 of them. Why you would invite 5 separate brand names to sell pills is beyond me, but apparently things are going well and people are buying the pills and revenues at 100 million. We'll be seeing a shitload of ads for this on TV soon because they'll spend, it's a massive growth thing. But this direct-to-consumer selling pills with a bit of telemedicine seems to be taking off.
Love it. All right, what else is taking off? Babylon Health is going public via a SPAC. $575 million expected to be raised during this. Their valuation, $3.6 billion on $79 million in revenue. So Matthew Holt, talk to me about Babylon.
Well, don't forget, about a few years back, I think it was 2018, they got 600 million, 500 million, 550 million. I think most of that came from the Saudi government. Much controversy about Babylon, not in the UK, because they're from the UK, not to mention their close connections to Matt Hancock, the kind of semi-disgraced UK health minister, but he's still in the government there with the rest of the disgraced people running that country. Ignoring my political views on my homeland, on my homeland's government, they're doing some interesting stuff. They worked with GPs in the UK. They bought a medical group and an IPA here, and maybe they can do something. But they have the chart of all charts in their deck.
Yes, we need to talk more about that. All right, Dr. Oz is back investing into a company along with Tony Robbins, Define Ventures and Link Ventures. This is Intrinsic Brands coming out of stealth. $113 million on this raise. This company is an e-commerce company that's supposed to buy a bunch of different healthcare brands that are selling on Amazon. Matthew Holt, make sense of this for me.
Cannot do it. So Redesign Health is the group that's like a VC studio that raised itself, what, 150 million to pump out new startups. Missy Krasner is somehow involved in that. This is, I don't understand. There's probably a financial game that's very clever. The people who understand how you buy, lightly known e-commerce brands and put them together and make a package out of this. It blows my mind that there is such a thing, and God knows what will be packaged up. I am a little confused about this because, Lin Zhao from Define are one of the smarter VCs around, so they obviously see a big opportunity. I can't believe anybody that thinks that Dr. Oz, I mean, I guess he has some publicity still, but that Dr. Oz and Tony Robbins have got any credibility left. Not many people in the medical field think, or the personal, or the psychology field think either one of those two have got much credibility, but we will see how it works out. The whole thing confused me. Their medical board's quite impressive. Gina Bravada, among others, I see is on it. So maybe, but I just don't get the business at all. But that's because I'm an idiot, not because there isn't the business there.
Maybe someone will let me interview them and we can find out more.
Apparently this is fairly common,
right? This is how we learn. This is how we learn.
But this is a bit like, right, all these, fan-based and celebrity-based water things that, vodka, the 50 Cent had a water company that got bought by Pepsi because it was his brand, and George Clooney had a vodka company. And I guess if you figured out enough healthcare stuff around that, people buying stuff online, you can roll it all up in the sort of healthcare consumer stuff, just like 30 Madison is rolling up, buying drugs that are prescription-only drugs, which shouldn't be. And there was one the other way, curing.
Oh, the one with the chronic pain.
Clearing, which was, repackaging and selling, videos of how to do workouts, plus videos how to do stretching, plus, that stuff you can buy in CVS for $9 that you rub on your skin to make it all go away. I can't remember. Anyway, there's a lot of weird stuff in money around drugs and supplies and all the rest of it, which is not connected to the healthcare system. And that's it. We'll have to ping our friends at Define Ventures and ask them what's going on here, because for them to lead that big around, I mean, they didn't have that. They raised a big fund, but I mean, that means they have real money.
13 million coming out of stealth. Like, that's crazy.
Well, just to know. Okay. Oh my God. Still, we only did 3. Last time I did one of these, which was in the middle of the session of the Go Behavioral Health thing, that I did 9. I was doing
more than that. But I mean, these were all merited a more specific and detailed explanation.
Well, the Babylon Health one is the Babylon Health one is quite exciting. If you're watching this and you go in and watch towards the end, I think it's like the last 15 minutes of the THCB gang. So Jeff Goldsmith, Mike McGee, and Kim Bellard on, we did a lot of talking about
me.
Wait. Don't get anxious there, young lady. We did a lot of talking about the Wuhan lab leak, because that's a really big story, which is going to get bigger. And then, Jess, you were over at the what the hell is it called?
Going Digital Behavioral Health Tech Conference.
Celebrity Media Conference. You were managing our chat group. And
I was managing our chat.
And you were finding there were lots of people who are fans of yours and not necessarily of me. Anyway.
We're not surprised.
Yeah, right. Anyway, but having done all that, right, you then snuck back over. Like right at the end of the Wuhan thing, I was trying to get people off that topic onto the Babylon Health thing, because that one chart which says they're going to make 30% margins and grow those margins over time as they get
taking them away from their health plan and provider clients, no less. No struggle at all. I'm telling you, this is the slide that every pitch deck from here to for moving on will have in their deck in some version or another.
I can't believe any of it. Well, none of it's in their 2020 revenue, because they didn't have any of that business in the year. I mean, so it's an entire new business model as well. A little bit worrying. I mean, I think it's a cooler technology story, and it's basically more interesting than Clover. But some of the stuff that was in Clover's SPAC deck, was like woo-woo stuff. And Emily Evans over at Hedgeye has been dismantling that piece by piece as Clover's stock price.
Clover is getting just beat up on Twitter right now.
Well, I mean, you know, Clover is, what does Emily call it? A small regional health fund that isn't growing. Valued as a tech company, you know, 20 times revenue. Oh, well.
All right. Well, for more of this great and inspiring chat on the dark side of health technology, why don't you follow along on Twitter at BoltyBoy, because he's got all the dirt over there. I'm sure you'll share that chart that you like from the Babylon investor deck or wherever you got that from. I don't even know, but that's a good one. You got to check that out, guys. And then you can follow me for, you know, general fun and merriment and poking fun at this guy over there. I'm at Jess.
Get fun, get merry. Right. Oh, by the way, Amy Abernethy got a new job.
You can't bring that up now, but yeah, she did. She's at Verily.
Verily, forsooth, I say. The wonderful Dr. Amy Abernethy. I'm
really
Shakespeare now.
We need like an update. Like there needs to be some sort of press release issued that is not about Amy, but about like what's going on there. I haven't heard anything come out of them since Luba Greenwood left. So, and that was like a year and a half.
I'm still very confused about what that organization is doing.
Yeah, don't know. So anyway, if you have any hot tips on that, you can be sure to reach out to us on Twitter. And to make sure that you never miss one of these insightful and thought-provoking Health in 2.00 episodes, please sign up for our email newsletter over there at thehealthcareblog.com. You'll receive these episodes as well as WTF Health interviews and curated content from the blog delivered directly into your inbox every weekend. And you can also subscribe on Twitter. No, not on Twitter, on YouTube, and make sure that you never miss an episode as soon as it's posted.
I remember all that. All right.
That's it.
We'll
see you guys next time. I can't even imagine who's going to get funding next because I feel like we've hit like some sort of
vortex, plateau.
Yeah, we've gone into overdrive now, and it's like I don't even know what's happening anymore. Can't wait to find out. See you guys soon. Bye.